Welcome to Psychology Hub with Dr. Rodriguez. In today's video, we'll be talking about major intelligence tests. I'll identify a list of intelligence tests, the age group for that specific test, the purpose and clinical use, as well as identify a list of other tests like group tests, tests for infants and whatnot. So the first test I'm going to identify is the Wechsler's Adult Intelligence Scale. Population would be for individuals 16 to 90 years old. The purpose would be measures overall adult intelligence functioning. The clinical use where we would utilize this test would be for neuropsychological assessment, learning disabilities, intellectual disability evaluations, traumatic brain injuries, dementia evaluations, ADHD evaluations, and disability determination. Second test would be the Wechsler's Intelligence Scale for Children, the WISC, the population, children, and adolescents. The age group for the Wechsler's Intelligence Scale for Children would be 6 years old to 16 years old and 11 months. The population, and it measures or evaluates cognitive abilities similar to the WAIS Adult Intelligence Test, but is more normed for younger individuals. Again, between the ages of 6 years old to 16 years old and 11 months. The third test would be the Wechsler's Preschool and Primary Scale of Intelligence. That's the WPPSI. The population is for younger children, approximately between 2.5 years old to 7 years old. Clinical use for the WPPSI would be in early developmental evaluations, preschool readiness, cognitive assessment in younger children, as well as the early intervention planning. The fourth test would be the Stanford-Binet Intelligence Scale. Historically, it's one of the oldest intelligence tests, originally based on Alfred Binet's work. It measures 5 broad cognitive factors, but before I say that, I want to identify that the age range is between 2 years old to 85 plus years old. The 5 broad cognitive factors would be fluid reasoning, knowledge, quantitative reasoning, visual spatial processing, and the 5th one would be working memory. And very important that the Stanford-Binet spans a wide range and it often used to assess both intellectual disability and gifted. The 5th one would be the Kaufman Assessment Battery for Children, the KABC. The age group, the age range would be 3 years old to 18 and 11 months. The purpose would be to evaluate children's cognitive processing with reduced emphasis on academic knowledge. The KABC has some strengths. For example, it's useful with culturally diverse populations, very, very important when you're working in a diverse area or a diverse population. Helpful for children with language differences, and it also emphasizes cognitive processes rather than school achievements. The 6th one would be the Differential Ability Scale, the DAS, the Differential Ability Scale, as it sounds. It measures multiple cognitive abilities in children and assesses in educational and developmental evaluations. The 7th test would be the Woodcock-Johnson test of cognitive abilities. And again, the purpose of the test is in the title, cognitive abilities. Oftentimes you'll see cognitive abilities, or you can use keywords in the title of a test. And if you don't, again, the Woodcock-Johnson test of cognitive abilities, the age range for this test would be 2 years old to 80 plus, 2 years old to 80 plus years of age. The Woodcock is based on the CHC theory, which is the Cattell-Horn-Carroll theory. It assesses the general intellectual abilities, cognitive processing, and academic-related cognitive skills. Remember, it's often used alongside achievement tests to identify learning disabilities. Eighth test will be the Lighter International Performance Scale. It's for age ranges between 3 to 75 plus years of age, and individuals with limited verbal abilities, very important. Some strengths are nonverbal administration, appropriate for hearing impaired, useful for autism spectrum disorder, as well as beneficial for individuals with limited English proficiency. The ninth test would be the Raven's Progressive Matrix. It measures fluid intelligence, abstract reasoning, and pattern recognition, and it's for age ranges between 5 to 11 years old. Some characteristics for this test would be minimal language demands, which can be helpful. Widely used internationally, it's recognized and considered one of the purest measures of fluid reasoning. 10th test would be the Universal Nonverbal Intelligence Test, which is identified as the UNIT, the unit. It's designed for individuals who cannot be fairly assessed using traditional verbal intelligence tests. It's useful for hearing impaired, language disorders, limited English proficiency, and culturally linguistic diversity. Shift a little bit. Let's talk about infant intelligence test. That would be the Bailey Scales of Intelligence and Toddler Development. It's primarily for infants and toddlers ages 1 to 42 months. Group intelligence tests, for example, would be the Cognitive Abilities Test, the COGAT, or the Otis Lennon School Abilities Test. Again, in closing, full scale IQ, the FSIQ, the mean is 100, the standard deviation is 15, and it's very important to understand that the average, which is 90 to 109, is right in the middle. Anything below would be below average, and anything below 70 would be significantly below average, and also would be interpreted alongside an adaptive functioning test. And then be mindful that anything above a 90 to a 190, above the average, anything above would be above average. And once you get to 30 plus, you'd be, 120 to 129 would be superior, and anything above 130 and above, like 145, would be very superior. Alrighty, thank you. And again, just a little recap. So the WAIS Adult Intelligence Scale, the purpose is for to test adult intelligence. The WAIS, the WISC, would be for child intelligence. The WPPSI, the WPPSI, would be to measure preschool intelligence. The Stanford Binet would be, the purpose would be to measure a broad lifespan intelligence assessment. The Woodcock-Johnson, the purpose is the cognitive abilities and academic related processing. The Raven's Progressive Matrix would be for fluid intelligence and minimal language demands, okay? The lighter would be, the purpose would be nonverbal intelligence. The unit, the UNIT, will be for nonverbal assessment for culturally and linguistic diverse individuals, very important. And lastly would be the Bailey Scales. It's for infants and toddlers, developmental assessment, okay? Thank you for your time. Please like, follow, and subscribe.